This video will provide general guidelines to help you prepare for your total hip replacement. Always follow the specific instructions of your surgeon or therapist. You will be called 2 business days before your surgery and provided with a time to arrive at the hospital. Generally, your arrival time will be 2 to 3 hours before your scheduled surgery time. You'll be given a special cleanser to use prior to coming to the hospital. At a minimum, you will use this to shower the day before and the morning of your surgery. You may be instructed to use it more days. Do not shave your surgery area. It could create a rash and delay your procedure. If you have a rash, your surgery may be canceled. A photo ID, insurance card or cards, co-payment if required, a list of your medications and dosages, including herbal supplements and over-the-counter medications, a list of your allergies, a list of your personal contact numbers, your CPAP machine and settings if you have sleep apnea, a copy of your advanced directives, personal hygiene products, walker or crutches if you already have them or are planning to borrow them, cases for glasses, contacts, dentures, hearing aids, etc., loose-fitting, comfortable clothing for the trip home. If you plan to go to a facility after your hospital stay, everything you bring should fit into one bag. Jewelry or valuables, large amounts of money, expensive electronics, any home medications unless specifically instructed, footwear that is not appropriate for physical therapy, including footwear that is too tight, too loose, flip-flops, high heels, or footwear that is difficult to put on, such as boots. Home DVT pumps. Bring your pumps only if you plan to go to a skilled nursing facility. We realize that the time in a hospital can be an anxious time, but rest assured that we have a great team of healthcare workers who will guide you through your total joint replacement surgery and stay. Please report to the first floor registration area. After you are registered, you and your family will take the lobby elevators to the 4th floor surgery waiting area, where you and your family will wait until you are taken to the pre-op area. You will be escorted to a room on the pre-op unit where you will be prepared for surgery. You will be dressed in a gown and an IV will be started. You will be asked what surgery and which side is to be operated on. We know the answer, but it is a safety check that is done for all our surgeries. The surgical team will identify the operative area, and your anesthesiologist will visit with you to discuss your anesthesia. After surgery, you will be taken to a recovery area, where you will remain until it is time to go to your room. When you awake from surgery, you will be receiving oxygen through a nasal cannula. This oxygen helps with healing, as well as helping you recover from anesthesia. You will have a blood pressure cuff on your arm and stickers on your chest to monitor your heart rate and blood pressure. You will also have an IV tube for continued fluids, antibiotics, and possible blood transfusions. You will have a protective dressing on your incision area. You may have a drain in your bladder, which will remove urine. This drain is removed the first day after surgery. Many patients will have a wound drain that will remove excess blood as healing occurs. You may have a triangle-shaped pillow between your legs to keep them from crossing. You will also have pumps on your legs that will gently squeeze and relax while you are in bed. You should have these pumps on whenever you are lying in bed. Immediately before and after your surgery, you will receive strong antibiotics while you are in the hospital. Most patients will not need antibiotics when they go home. You will be taken to your room and your nurse will orient you to the call light and other aspects. You can begin your bed exercises. Remember, you will do these exercises every hour that you are awake. Once in your room, you should also begin using your breathing device and do deep breathing exercises. This will help to prevent fluids collecting in your lungs. Because you will need to get used to your new joint and because of the medication that you've had for pain control and anesthesia, you will be placed on fall precautions. Do not attempt to get out of bed for any reason without a staff member assisting you. If you are on the orthopedic floor before 5 p.m., physical therapy will come up on the day of surgery to help you out of bed and to walk as much as you are able. If you are unable to walk at this time, the nurses will help you dangle your legs at bedside so you can get off your back. The staff will help train you how to move safely in and out of bed with your new hip. You will be taught how to use an ambulatory device to help you move about. That is, a walker or crutches, depending on the best equipment for you. Tell your loved ones to wash their hands when they come to visit you. We have hand sanitizer dispensers in all rooms and throughout the hospital. We are committed to keeping your discomfort to a minimum. Some medications are only given when you ask for something for pain. So if you are in pain, ask for something. The nurse will let you know what your pain management options are at any given time. You will also be using ice packs, both at the hospital and at home, to help with pain management and swelling. Most patients will receive medications that they may not usually take. Your nurse will tell you what a new medicine is for and describe possible side effects. Some pain medication may cause constipation, nausea, vomiting, or itching. Blood thinners may cause itching, increased bruising, black stools, red urine, or excessive bleeding. If you experience these symptoms, let your nurse know. For a time during and after your surgery, you may be limited in your ability to walk and move around. This can cause your blood circulation to get sluggish or slow, and blood clots could develop. Leg exercises will help your blood circulation. In addition, your doctor will order a medicine called an anticoagulant. This medicine helps to keep your blood from clotting as easily. You will also have air compression wraps on your legs that attach to a small pump. Air is pumped in and out, compressing and relaxing around your legs to increase blood circulation. As you progress day by day with your walking and ability to move more normally with your new joint, the risk of blood clots forming is reduced. Starting the day after surgery, you will be doing exercises to help strengthen your operative leg and walking with therapy twice a day. It's important that you participate fully in these therapy sessions so that you regain your strength as quickly as possible. We will review any precautions you need to follow in order for you to protect your new joint. Most of our total joint patients are discharged the first or second day after surgery. We will give you instructions for exercises to continue doing after you leave the hospital. We will go through discharge instructions with you on the day before you go home. A follow-up appointment with your surgeon will be scheduled. Your follow-up appointments are very important. Your instructions will include how to care for your incision, when you may shower, exercises you should be doing, and what precautions you will keep until your surgeon tells you otherwise. You'll be given prescriptions for medicine you will need at home. Restart the medicines you were taking before surgery as directed by your doctor. If your plans are to go to a facility after your hospital stay, ambulance transportation can be arranged and may be partially covered by your insurance or Medicare. However, your family should be able to transport you from the hospital to home or a facility. For those of you going home, someone must drive you home after discharge. Our staff will assist you to get into the car. Getting in and out of the car will be very similar to how you will learn to get in and out of bed. You will need a cushion in the seat to keep your hip in the proper position. If your car is unusually high or low, you may want your helper or family to borrow a midsize or large car. You will not be able to drive yourself until you are no longer taking pain medications. If your replacement is on the right side, you should not drive until you have full and safe use of that leg. That may take 4 to 8 weeks depending on your surgery and recovery. You may be able to drive sooner if your replacement is on your left side. Thank you for viewing this video. The better prepared you are for your joint replacement, the easier recovery will be.